Tonight, a man still in critical condition after a hot oiler truck in Midland County exploded nearly 2 weeks ago. Now, most burn victims are sent to Lubbock. That's because there isn't a burn unit in Midland or Odessa. Instead, hospital staff focuses on patient transfer care, ensuring burn patients survive while they're being transported. But how do you train nursing students to do that? At UT Permian Basin College, it's a hands-on experience.
The moment disaster strikes, the clock is ticking to get the right care, even in a special case like burns. Those type of wounds are treated different than others, especially in West Texas.
It's not something that necessarily students or nurses may see on a daily basis. Since we are not a regional burn center, it is important for them to know how to take action and initially care for a patient.
If someone is burned at home or on the job in our area, in most cases, they're sent to the closest burn unit, nearly 150 miles away in Lubbock. Harrington says nurses in Midland, Odessa play a vital role in burn victim survival.
Well, it's important first of us to start the initial care properly because that will help the patient as well as future care providers that the patient will go to.
That's why their students are getting hands-on training.
And also the other one,
The university staff created burn wounds on simulated mannequins so students could see how to treat burn victims, like inserting IVs into damaged skin.
Actually started with some red paint for the base, and then we used clear Elmer's glue, put that down, used one-ply toilet tissue, and put that on there, and that kind of gave the impression of skin peeling.
A realistic scenario created so the students will be prepared for anything and everything, no matter the level of trauma center these future nurses will work in. In Odessa, Tate Owen, NewsWest 9.
Right now, Medical Center Hospital is a level 2 trauma center, but Trevor Tankersley, the director of public relations with MCH, says their ultimate goal is to become a level 1 trauma center. A level 1 trauma center can handle any medical emergency without having to bring in outsourced doctors or fly patients out. While they're working on upgrading their hospital, he says it's a process and will take a couple of years.